So now we're going to move into some just a couple of really quick things. The pros and the cons of the CSIL program, because there's lots of advantages about going on to the CSIL program, but there are some reality checks which can be disadvantages for some people because you are running basically a small business.
Absolutely.
You're the employer, you're the boss. There's a lot of things, just like any normal boss. You have to deal with HR, you have to deal with hiring, firing, all those other issues that some of us don't like to deal with, training, accounting, revenue, all those sort of things. So it is a small business that you're doing. So
it is, and you're dealing with different personalities all the time, and they have their needs too, and you're trying to be able to balance it all. But it's people really do describe it as running a small business, and needing to be on top of things. But let's talk about the pros first,
yes.
because I think that there are a lot of pros, and I think the first point is a very strong one. That the attendant job description based on your activities,
right?
Your priorities, your values. I think that is the one that it hits home, right? Once you've been assessed for your hours, you make decisions, right?
Yes.
If you normally have a shower every day, but you choose not to have a shower because today your priority is to be able to go and see your family member or go do something else, with your staff person. That is something you can do on the CSIL program. You're choosing the types of care and how you want your care to be done in the way you want it to be done. Having control, over the tasks and, again, I think it's going back to that whole freedom and control and really back to being centered to the individual. And I really believe that the pros are pretty heavy. People are talking about it all the time. I don't know very many people that have gone on the CSIL program and then gone off of the program, because they wanted to.
Oh, definitely,
right?
Yeah.
For sure.
Yeah.
So.